Vanakkam, good morning. In this video, we are going to discuss about the cytokine. Cytokines are small proteins. It is involved in the immunomodulation. It is important for the cell signaling and intercellular communications, intercellular chemical messenger. So it is produced from the lymphocytes, granulocytes, macrophages, endothelial cells and mast cells. So these cytokines act on the target cells, produce the immune response. Here we are going to discuss about the important cytokines. Interleukin. Interleukin is the polypeptide type of cytokines. It is 16 types, interleukin 1, 2, 3 like that. It is important for the immunity. It is the important immunity mediator, and it is also play the important role in the hemopoiesis, production of the WBC, RBC and platelets. It has the important mediator role in the fever and inflammation. The second important cytokine is the interferon. It is act as the antiviral agent. It is also act as against the cancer cells. It has three types: interferon alpha, beta and gamma. And colony stimulating factor also act as the cytokines. These three types: colony stimulating factor for the granulocyte monocytes, colony stimulating factor for the macrophages, colony stimulating factor for the granulocytes. These are play important role in the proliferation of the pluripotent stem cells in the hemopoiesis, production of the WBC, RBC and platelets. Next important cytokine is the tumor necrosis factor. It is important for the necrosis of the tumor cells or killing of death of the tumor cells. These three types: tumor necrosis factor alpha, tumor necrosis factor beta and tumor necrosis factor gamma. So it is mainly act against the tumor cells. And chemokines. Chemokine means it is more attractive towards the infective organisms. So it kills the infective organism by chemoattractants. Okay. So the interleukins are act as the chemoattractant for the infective organisms. And defensin is another important cytokines. It is act as the antimicrobial peptides, that is act against the infective agents. Alpha defensin mainly produced from the neutrophil macrophages and intestinal panic cells. Beta defensin mainly produced from the airway epithelial cells, salivary gland and cutaneous cells. Next cytokine is the cathelicidins. It is act as the antimicrobial peptides, mainly act on the air passage and lungs. And the platelet activating factor also acts as a cytokine. It is important for the platelet agglutination and aggregation. The cytokine play the important role in the viral infections. So it produces a hypercytokinemia. Cytokine amount is increased. Sudden release of large quantities of the cytokine is called as a hypercytokinemia. It is mainly produced during the viral infections, especially in the coronavirus, and it produces a multi-system organ failure. It more prone for the death. So cytokine storm is the danger for the patients. So it is the sudden release of large quantities of the cytokine. So patients goes to the multi-system organ failure. So it is the abnormal conditions, pathological condition only it produces cytokine storm. Thank you for watching this video. If you like this video, press the like button and share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbook. Thank you once again.